This is how the New York Times thinks awareness of men's health should be raised. Neon titty bar signs about beer, wings, sports, and color TV. In the United States, I could find 19 hospitals dedicated to women and 0 for men, and 27 preventive services for women with only 1 for men. Just like the exposure I did with revealing the education industry scam on men, this is the same theme in a different industry. In this series, I'm breaking it down. Men die younger, how healthcare ignores them, and what it would take for things to finally change. In part 1, we start with last week's New York Times story about one of the only men's health centers in America and what the article reveals about why men live 5 years less than women. The article was a feature on the Cutler Center for Men in Cleveland. It's one of the few clinics in the country that's intentionally bringing men into the healthcare system. The article's message is simple and unoriginal, but unsettling nonetheless. Men in the United States live 5 years less than women, in part because they avoid doctors, but also because the system itself gives them fewer entry points and less structural support. The author of the article argues that without cultural change and institutional involvement, men will keep showing up only when it's too late and after their damage is already done. So it's no surprise that men in the U.S. live an average of 5.3 years less than women. And that gap widened dramatically during COVID pandemic when men died nearly 60% higher rates, often because of unintended pre-existing conditions. Men die from 14 of the top 15 leading causes of death, and often years earlier than women. And I argue that the reasons are far more than the health industry admits about culture, the healthcare industry, and why institutions quietly devalue men's health. The Times article highlights that what doctors see every day, including that men don't show up into the doctor's office until it's too late. According to reports, men often start to avoid the doctor's office in adolescence and then reappear years later in emergency rooms with advanced cancers, heart attacks, strokes, and usually after their wives or their daughters dragged them there. According to reports, women drive 80% of medical decisions in households and are nearly twice as likely to have had a checkup in the past year. Men, on the other hand, often take pride in saying, "I haven't seen a doctor in years." And that pride is the cultural script of precarious manhood. It's the belief that being a man includes expressing toughness through denial. But culture does not live or operate in a vacuum. The system reinforces men's absence from health care. As an example, the Affordable Health Care Act guarantees 27 preventive services for women, but only 1 for men. As an example, breast cancer screening is built on established and clear recommendations, such as starting regular mammograms at age 40, while prostate cancer screening is vague and far less discussed. There's an entire cultural movement built around pink ribbons and early detection for women. Hell, Inter Miami's arena, just down the street from me, named their entire stadium after women's health. Who even knows the color of ribbon for prostate cancer? And when the media covers men's health at all, it does so with mockery. Look at these neon sign images again from the Times that they ran right alongside their article. Prostate exams, wings, beer, color television, music, good food. The message that the Times sends is that to get men into healthcare, you need to market medical clinics like titty bars. Imagine if an article on breast cancer came with images of Chippendales, cats, and boxed wine. People would lose their fucking minds. Healthcare institutions rarely come out and say, men's health is less important, but their structures say it for them. Just like I explained in my university accreditation battle video a few weeks ago. The official claim is that the system is neutral toward men. Yet public visibility makes clear those concerns whose get attended and those whose do not. My contention is that men don't avoid doctors just out of laziness or out of pride. They absorb a constant signal that the healthcare system and facilities within it are not built for them. No hospitals in their name, no offices in Washington advocating for them, no pathways designed around their care. So when a man finally considers stepping into the healthcare system, he's treated like a guy who needs free chicken wings to make that choice. According to the Times article, the Cutler Center for Men in Cleveland is attempting to help men by easing their entry into healthcare. With pool tables, flat screen TVs, and staff navigators who handle logistics and nudge men toward colonoscopies or follow-up visits. Apparently this facility is helping because Cutler is actively attempting to attract men. And apparently when the system does go after men like that, men actually show up. As reported in the Times article, at Cutler, men are 40% more likely to keep appointments and 35% more likely to keep their diabetes under control. Now that should not be remarkable, but it is, because almost nowhere else in the United States has even tried to build designated facilities or networks for men, and that's a problem. Men should not need pool tables and flat screen TVs to be tricked into care. They need dedicated facilities, full services, and national advocacy, not bullshit gimmicks. This is the problem that we need to face head on. Men die younger, not just because of their choices, but because of the options available to them. In part 2, I'll break down the details in the numbers. Hospitals and medical centers built explicitly for women versus those for men. And then in part 3, I'll discuss the consequences. Higher death rates, the loss of fathers and husbands, and a culture that treats men's access to care as optional until it's too late. In part 2, I'm breaking down numbers about the healthcare industry model. Specifically that women have hospitals and thousands of clinics dedicated to them, while men are left with almost nothing. In the United States, as best as I can find, there are roughly 19 active women's hospitals, whether they're facilities or heavily branded clinics dedicated specifically to women's care. If you include a couple of notable mentions and facilities that are currently under construction, that number climbs to about 22. By contrast, there are 0 equivalent men's hospitals anywhere in the country. That fact alone is striking, I think. The medical system has invested in building entire hospitals for women's health at the center of their identity, while men have never been given a single parallel institution. When we zoom out beyond hospitals a little bit, the imbalance of facilities becomes even greater. Using federal and association data from the Health Resources and Services Administration, the Office on Women's Health, the National Health Directories and Hospital Directories, there are about 3,600 women's health centers across the nation. Those include OBGYN, breast clinic health centers, reproductive health centers, specialty divisions that are offered at larger hospitals. In other words, if a large facility registers as providing women's health services, it shows up in that count of 3,600. That scale means that in virtually every state, in every metro area, women can access a web of dedicated health providers with professional building and branding and a focus that reinforces the message to women that your health is important enough to have its own infrastructure. And this is how universities advertise it. A Fort Lauderdale university outright tells women they are the primary health decision makers and then builds services around that claim. Northwestern University's hospital complex in Chicago brands a women's hospital in giant purple letters. UCLA splashes pink across campus for their Iris Cantor Women's Health Center while issuing official university statements in defense of women's productive care. You've never seen the equivalent branded for men, and this isn't just some one-off. From state-run facilities to private medical centers, the entire system normalizes care that's branded for women. Men, by contrast, have no equivalent network. Applying the same method to identify identify dedicated facilities for men, there isn't a registry that produces a national number for men's health accommodations because those facilities as a category are not even tracked at the federal level. Instead, care for men is fractured across urology departments, cardiology, oncology, and primary care with no umbrella to identify or exist as branding for that service. The infrastructure for men's health facilities simply does not exist. If we narrow the scope to look only at branded, dedicated centers, the picture changes but still reveals an imbalance. Men's health centers, under this definition, the number is only about 150 to 200 nationwide. These are places that actually post names like Men's Health Center or Men's Clinic on their door or in their advertising. These would be facilities like the Preston Robert Tisch Center for Men's Health at NYU, the Iris Cantor Men's Health Center at New York Presbyterian, or the centers at Cleveland Clinic, Mayo, at UCLA, UC San Diego, and a handful of other academic medical hubs. Women's health centers using the exact same branded only rule also fall into the low hundreds, somewhere again between 150 250 nationwide. Now, at first glance, that last categorization of facilities might suggest some type of parity. Both men and women have a couple hundred branded centers. But that, looking at only that number, overlooks the deeper point. Women's health centers are often large-scale hospitals, central institutes, or major divisions with their own budgets, networks, and institutional clout. They're integrated into the public and the academic identity of their healthcare systems and marketed widely. Men's health centers, on the other hand, are usually small clinics, niche programs, or side branches in suburban office buildings that are distanced from larger hospital departments. The point is that even where the numbers appear to be similar, the weight and access to gender-specific facilities is not. Women's health is institutionally prioritized. It's centralized, robust, and tied to visible infrastructure. Meanwhile, men's health is fragmented, evolving, and underbranded. And this difference in scope means that women encounter healthcare as something designed with them in mind, while men encounter healthcare as something that they're expected to find in fragmented pieces, often in places that were not built for their identity or their unique health risks at the forefront. I really believe that the lack of dedicated healthcare facilities for men matters because it helps explain why men, culturally, may perceive healthcare as not for them. It reinforces the stereotype that men should just tough it out and avoid doctors because when they do seek care, there's no clear institutional pathway that says, this place exists for you. Bluntly, the absence of men's hospitals and the lack of men's health branding is not just an oversight. It's a conscious decision. And the decision is men's lives are worth less than women's. Coming up in part 3, we'll get into the consequences, why the missing infrastructure for men leads directly to higher mortality and broken families. In part 3, we turn to the consequences of what happens when the health industry's neglect turns fatal and why the model keeps men excluded. In part 1, we saw how men die earlier and how the system shrugs it off. In part 2, we looked at the hospitals and clinics that prove it's not built for men. Lack of men's involvement in healthcare is the same shit we saw with the education system I exposed a few weeks ago, enforcing policies and gatekeeping in ways that affect who decides who enters the system. Healthcare runs the exact same model as the education system. On paper, men and women both have access to see doctors. But in practice, in promotion and service, women get full hospitals, they get branded health centers, federal offices, and legislative help. Men get piecemeal clinics and neon signs that look like beer ads. And the cost of that industrial approach is brutal. Men are dying earlier, 5 years on average, from heart disease, high blood pressure, diabetes, lung cancer, and a dozen other conditions. Half of adult men in this country have hypertension, but few of them take their meds when they're prescribed. But pink ribbons, breast cancer walks, ovarian cancer awareness, reproductive campaigns, those are everywhere. Meanwhile, prostate cancer or men's lung cancer, you'd be lucky if anyone even knows the color of ribbon for those. That imbalance is baked into the Western healthcare industry, and it's evidenced by those who live longest. Ultimately, the loop feeds itself as men are not bombarded by everything designed and designated for them. So they rarely see buildings or ads that welcome them into healthcare. And I'd argue that it's not because they're too stubborn or to be healthy. And honestly, I don't entirely fault them. Yes, men wait until they're in a crisis, and by the time they walk through a hospital door, it's often too late. But their greeting to the system is that, well, it's your fault. Men just don't go see the doctor. And again, this is the exact same shit that the education industrial complex has been pulling for 40 years, pretending that men and women should be equal, and then acting surprised when men don't show up. And believe me, this is not just healthcare and education. Those are just two of the largest industries in the world, and they're both running on the same model. Culturally, politically, economically, in every major social construct you look, men are choosing to not participate. They're advertised to and sold as dysfunctional, and they don't like it. So sick men spend more time in crisis care. Disengaged men are easier to sideline politically, and exhausted men don't fight back whether they're written off at work, in the courtrooms, or in healthcare. There's no conspiracy memo, but the collusion is clear in outcomes. Over and over again, systems do not invite men in. They wait for them to reach crisis and then provide an unwelcome or demeaning experience when they do try to enter. And universities brag about their women's health hospitals and centers while burying men's clinics in suburban strip malls. Meanwhile, politicians discuss so-called equity while half of the population is quietly losing 5 years of life. None of this is neutral, and I don't think any of it is accidental. It's not that nobody knows men die younger. It's that nobody cares enough to change the model as it exists. So the challenge is obvious, but very heavy. Demand parity. It's to force the healthcare system to give men equal structural weight and access to their system. That means offices for men's health at the federal level. It means clear screening guidelines and branded institutions that make it normal for men to show up every day and to do it early. It means healthcare built with men in mind, not cartoonish, bullshit neon signs and pool tables like a neighborhood pub. And until that happens, the cycle cannot break itself. Men will keep avoiding healthcare, the system will keep blaming them for it, and families will continue losing fathers, husbands, brothers, and sons way before they should. So, to answer the question, New York Times, what does it take to get men to see a doctor? It takes building a society that values their lives before they're already dead, and stops pretending that neutral or equitable rules aren't just another way to write men off. So I want to know what you think. What's your experience with entering the healthcare system? Leave a comment for us to discuss, and then watch one of these videos that YouTube has picked out for you, and I'll see you soon.